In this video, I want to help you determine whether your BJJ injury is an acute traumatic type injury or a chronic overuse type injury, so you can best manage it and stop it from becoming a long-term problem. So if this is all unknown territory to you and you want to know the difference between acute traumatic type injuries and chronic overuse type injuries and why it matters, I recommend you first watch my video on that topic. However, if you don't need that explanation, this video is to help you determine whether or not your injury is an acute one or a chronic one so you can best manage it. So in many cases, this difference is really easy to work out. So if you have some sort of accident, that is a perfect example of an acute traumatic type injury. You didn't have an injury, something happened, and now you do. So, really good examples of this would be you fell off your bike and broke your wrist, or someone kicked you in the ribs and broke one of them, something like that. Really simple, a clear, precipitating event that led to an injury. Now, on the flip side, if you had some sort of niggle that got worse and worse over time, that's what chronic overuse type injuries tend to look like. These are normally caused by some sort of mechanical issue in the body, either some sort of movement dysfunction, overuse, repetitive strain, maybe a postural issue. Something that's fine at first, but that inherent dysfunction tends to abnormally load one part of the body, which over time starts to become a problem. Now, importantly in this case, and what often surprises people, is that these type of injuries are actually much more common and normally much more tricky to deal with. And in order to solve this problem, you need to first identify the type of injury you have properly. Now, what's really important to note, and what people often get wrong, is that chronic overuse type injuries can often masquerade as acute traumatic injuries. So to illustrate this, I want to give the example of a patient of mine. So this is a guy who's a young guy who lifts weights and also does BJJ. And one day he was doing a Zercher squat, which for those of you who don't know, it's like a front-loaded squat where you have the bar in the crook of your elbows. And, he's quite a strong young guy. He can normally lift about 120 kilos or so in this exercise for a few reps. But one day he was warming up with about 80 kilos. He felt something in his back go, and he was on a really high level of pain for a few days after, which is what led him to coming to my clinic. Now, on the surface, this seems like a pretty clear example of an acute traumatic injury. However, there's quite a serious clue in that information I just gave you that actually indicates it's more likely a chronic overuse type injury that's masquerading as an acute traumatic injury. And that's the fact that he hurt himself lifting a weight that was quite significantly below his maximum capacity. This is a guy who can lift well over 100 kilos, but he hurt himself lifting only 80 kilos, which doesn't really make a whole lot of sense. Now, of course, you can hurt yourself in the gym acutely, traumatically, if you're going for a max lift, or if you've got a really bad training program, or if you're just fucking around doing stupid things. However, those type of injuries are actually quite rare. And in my time working clinically, often when someone thinks they have had an acute injury, what they've actually experienced is just the straw that broke the camel's back, the final stage in a process of abnormal loading and stress accumulation in a part of the body that has finally just said enough is enough and given way. This leads us to mistakenly think that we've just had an acute accident. So all we need to do is rest up, heal up, and the injury is dealt with. However, if that's not the case, and what you actually have is a chronic overuse, abnormal loading type injury, if you don't get to the heart of the issue and treat the dysfunction that led to the injury in the first place, it's likely to keep coming up over and over again. So my best advice in this case is to ask yourself 3 questions for any type of injury. Firstly, have I injured this part of my body before? Secondly, was there any lead up to this injury, any niggles or soreness that you ignored? And thirdly, Was there actually an obvious precipitating event, or am I just looking for one to try and make sense of it all? If the answer is yes to any of these three questions, I'd be willing to bet that your injury is most likely a chronic abnormal overuse type injury and not an acute injury. And if you want to get to the bottom of it and truly fix it, you need to treat it as such. I hope you found that information useful. If you want some advice on the differences between how to manage an acute traumatic type injury and a chronic overuse abnormal loading type injury, you can watch my video on that topic. If you enjoyed the video, please give it a like and subscribe to Matside Maintenance for future videos and more valuable content. If you have any questions or suggestions for future videos, please leave them in the comments below. I'm here to help you train harder for longer and, importantly, as pain-free as possible.